As Canada ramps up efforts to strengthen its sovereignty through major nation-building initiatives, veteran health advocate Russell Williams argues that healthcare must be at the heart of the agenda. In a wide-ranging conversation, Williams calls on governments and industry to treat healthcare as Canada's defining national project, one essential to the country's future success. Fresh into retirement and reflecting on a career that spanned elected politics, health advocacy, and leadership positions in the life sciences and biotech sectors, Williams sat down for a Q&A, sharing insights, lessons, and hopes for the future of healthcare in Canada.
And there was an opportunity that came up in a very charged time about linguistic politics. And I decided that as much as I was concerned about what the government had done on language, for sure, I thought I could change from within. So I ran, and I won the first election. It was a difficult election, and then I ended up running 4 more times. And the first 6 years was 2 elections and 2 referendums. So very energetic and emotional times.
What kept you coming back, and what did you enjoy about that work?
Being elected is a very honorable profession, so I'm proud of that work. And what you can do with your office and the influence of the office is really make change happen. And whether it's working with large projects, industry, human rights issues, etc., you can make real differences. So without going through everything that I achieved, some of the things with industry, for instance, I passed at the time a pretty innovative pharmaceutical policy that encouraged more research and development in Quebec, because we were supporting innovative medicine, access to innovative medicines and vaccines. Some of my other work was bringing voice to people that didn't have voice, whether it was family, foster families, whether it was young kids needing cochlear implants, whether it was other areas that really had difficulties getting representation. And I tended to get results. I tended to make things happen. When I couldn't get attention, we would fill the National Assembly with those groups and really push everybody. So that was very exciting. And it was exciting to be somebody who was born in London, Ontario, and to become that involved in a small way, in the future directions of Quebec. It was a mixture of politics, industry, and improving healthcare. And that combination really, really excited me. And again, in politics, you should know when to get in, and you should know when to get out. Most of my political career was in opposition. You have to lead by influence. You have to lead by collaborative positioning. You have to build momentum with others. And it means compromise. It means working hand in hand with others. It means adding certain things to an agenda or taking certain things off. I don't think any one of my projects that I started finished exactly the way I planned in the beginning. They evolved, usually got better, and improved, and sometimes took longer than I planned. But if you're tenacious and you're committed to results, you can achieve those. And I think that kind of style within politics has helped me continue to do the work that I do, as I'm very proud of. So some of the things, we changed some of the IP rules, data protection. We improved the way governments see the industry. We did partnerships. We improved the quality of care by getting, still lots of work to do, but to get better access to innovative medicines. The thing that I'm most proud of is we empowered a lot of patients to have a greater voice, to be able to push for better access, to express why innovative medicines work and why they're necessary. And I think in a small way, we have the governments now thinking a little bit more about an investment in healthcare is in fact that versus an expense. And one of the things that I think we have to do is continue to do that. Too often in our decision-making process, we see the costs of Medicare and medical services, and we don't see the investment, we don't see the benefit, that how that is a very strategic and good use of limited public dollars. Too often in a complex world of life sciences and healthcare, the various sectors don't talk to each other. And one of the things what we wanted to do is bring people closer together. And we started to actually bring doctors, nurses, pharmacists, industry, hospitals, patients together and talk through issues of ethics and what we think is important. And what we discovered actually is we have a lot in common. We're advancing this work throughout the entire APEC region. And I think we've actually improved healthcare because without the highest standards of ethics, there is no innovation. There is no real research. There is no discovery that we can count on. But with the strongest ethical standards and in a transparent way and in a measurable way, you can ensure that we are advancing innovation and better healthcare. My earlier career was patient advocacy. And then I went into the political realm, and then I went into industry, and then I returned back to my roots in terms of patient advocacy. So I'm very proud that, one, we've increased the understanding about diabetes, and it's much more part of the public policy. Two is we have a framework, and then three, within that, practical improvements have happened in each of the provinces. And each province does it a little bit differently, but there have been real improvements on it. One of the recent improvements is there have been this commitment towards what is called national pharmacare. And it primarily started on diabetes, and it's I'm not sure it's the answer to move forward, and I'm not sure a single payer, first payer system is the answer. In fact, I know that private-public partnerships is much more of the answer, and filling in gaps is probably the best strategy versus rejigging the system. That being said, that was a step forward for people with diabetes, and that's exciting. Ultimately, we have to improve access to medications, innovative medicines and devices, because it's short-sighted not to make those medicines available, because quality of life is diminished and it ultimately costs the healthcare system more money.
What advice would you give to young professionals on how to navigate and lead within the public policy landscape?
Tough question. One is listen. Listen and build coalitions. One of my first mentors, way back in those early days when I was talking about the YMCA and youth work, was a friend of mine that said, "You're as good as your network," and you have to keep building coalitions and networks to make sure that you can make change happen. Two is you should make sure that you're not solely committed to only one policy. You should be open to listening to other advancements. The other thing is, within Canada in particular, the healthcare system is interesting. Don't advocate without evidence. Make sure that you know what you're talking about. Good data is important. I guess the other advice is do it in public. Do it transparently. Engage the population. Use the media. Use the energy of people. There are, on any public policy file that you'd be interested in, there are passionate, articulate people willing to give and work hard on it. And those, from a leadership point of view, those are the champions. Those are the people that will win the day. Ultimately, public policy should reflect the society that it serves. A number of the people have talked to me about the role I played in allyship. And as I mentioned the other day, I didn't even know what the word was until some of the professional women that I've worked with were using it. And that I'm really proud of. And it basically was just supporting people. It wasn't even mentorship. It was supporting and giving some background, a little confidence, encouraging, pushing maybe a little bit. But I have been really fortunate that there are numerous professional women that I've had the privilege to work with and are now leading huge foundations, big projects, global roles in companies. And what I did with them wasn't that much, but support them and give them some guidance and go through it. And ultimately, I think society's better off.
How do you feel about businesses moving away from DEI following Donald Trump's election in the States?
It makes no sense to move away from it. It just, it should become part of our day-to-day functioning. In fact, I think we should, and I don't like this expression, double down on it. We should embrace diversity. We should embrace, encourage, and diversity of thought too. That starts with your hiring process. It starts with your board of directors. It starts with your general philosophy. I think back on Diabetes Canada, when you look at high prevalence communities, if you weren't embracing prevalence, you're missing many of the communities that are directly affected by diabetes. But it doesn't stop there. We have to embrace that, and I think those that move away from it will regret that seriously in the future. I'm a former Quebec politician, and I don't think the federal government should be running healthcare. Ultimately, the Constitution sets up that healthcare is a provincial responsibility. That being said, the government, whether it was on the diabetes framework or mental health or a number of issues, can lead the way. And so when I think about nation building that we're talking about, and we're spending a lot of time with that, and I'm excited. I haven't felt this sort of amount of pride in Canada than I'm sensing that we have on the streets now in a long time. But when I think about nation building, I think about our healthcare system. I think about what makes us proud. I think about life sciences. I think about innovation and research. And that, you're right, wasn't part of the mandate letter. But I think we can still make it part of the mandate. If we're nation building, we have the fundamentals of probably one of the most respected healthcare systems in the world. It's got problems. It's got serious challenges. But the kinds of things that we could be doing together right now, if we think about investing in healthcare, not just an expense, investing in research, investing in better access to innovative medicines and vaccines and medical devices, investing in building capacity. Can we seize this opportunity too to build an even stronger healthcare system that's coming from the provinces? I don't have rose-colored glasses on. It'll be tough, but as we're thinking about investing in some of those big national projects, I think the biggest national project we have is our healthcare system.
What is keeping you up at night from a public policy perspective at the moment? And what are some solutions you're looking for?
I think as most Canadians, when we watch the news and we hear what's going on south of the border, I'm deeply concerned of what's going on to our democratic principles, to our democratic institutions, we talked about ethics before, and to the kinds of things that we stand for and that we believe are very important. So I'm concerned about those. Why it keeps me up at night is difficult to think about what one can do in Canada. But I think what one can do is understand a little bit, or try to understand what's going on in the US, but then seize the opportunity from a Canadian perspective and build. One of the things that keeps me going, and a lot of people think that were surprised that I retired, is that there's always possibilities to build. This to me, I think, I know the question was what keeps you up at night. What I turn it around a little bit and said what excites me is it seems that the country is coming together. It seems that we might put some of our barriers aside. It seems that we might work a little hard to join forces. We'll see